Welcome back. October is National Physical Therapy Month.
And here to tell us about the importance of PT is Angela Cusick with Christie Clinic. Good morning.
Good morning.
How you doing?
Very well, thank you.
Good, good. So tell us what physical therapy is.
You know, physical therapists are probably, for lack of a better phrase, are movement specialists. And we assess things that cause you pain, we assess things that make you feel better, and we establish exercise programs. We do a lot of hands-on therapy, and we do a lot of patient education.
Sure. So there are many situations in which someone might need physical therapy. You know, what are a few of them?
You know, chronic pain is a great way to, physical therapy is a great way to address chronic pain. And especially as you get older and you get low back pain, there are a lot of exercises, there are a lot of activities that you can do that will really alleviate your pain. And there are a lot of manual therapy treatments that we can do that keep you from having to use pain medications, that keep you from having to have surgery. And so we provide a lot of outlets that maybe keep things a little safer and give you opportunities to control your own pain and not have to rely on other people for mechanisms to control that pain.
So maybe somebody doesn't necessarily see surgery in their future, or maybe doesn't have to deal with that quite yet, but maybe they are feeling some pain. When do you suggest is the time to call a physical therapist?
When you start to be limited in your activities, when you start to notice the things I really enjoy, the things that give me quality of life are limited, then you really should reach out for therapy before it gets too bad.
Yeah.
And especially if you're starting to have to rely on Tylenol and ibuprofen, things like that, there are opportunities to use manual therapy. We have modalities like electrical stimulus and ultrasound and things like that that can help control your pain without having to rely on things like that. But really, sooner rather than later is better, and especially when you have shoulder pain or low back pain, those things can be addressed really readily with therapeutic exercise and manual therapy.
Sure. Physical therapy is also especially important if you have a hip or a knee replacement.
Correct. It's vital. I've heard doctors say that 90% of the recovery is what you do after surgery. And so immediately getting into treatment, immediately getting into a professional who can do manual range of motion, teach you the proper exercises, teach you ways of managing your inflammation and your pain without having to take so many pain medications.
Do you think that a lot of people find that once they start going to a physical therapist, they're going to have to go through treatments for a very long period of time?
You know, that's one of the things with physical therapy is we're very specific, and we want to make you independent in your own recovery. So we want you to be able to learn the exercises. We want you to be able to learn to follow through on your own. So you shouldn't need physical therapy for more than 4 to 6 weeks after a chronic complaint, after surgery 6 to 12 weeks, and then you're on your own and you can manage things on your own and enjoy your life and not have to continue to go to treatment after treatment.
Sure.
Right.
So if somebody is not sure whether or not they need physical therapy in the near future, talking to your doctor is a good idea.
Correct. Yeah. Talk to your doctor and let them give you a referral. And the nice thing is especially at Christie, we work together as a really tight-knit team, and we'll work together to know whether or not we're the right answer for you. And if we're not the answer for you, we'll direct you in the direction that you need to go to get the help that you need. And we won't waste your time with physical therapy if it's not the appropriate treatment.
I'm
Very
sure
good.
a lot of people are going to be happy to hear that.
Yeah.
Thank you so much, Angela.
You're
for being
welcome.
here.
So much.
Thank you.